Know what a quarter a week can buy? Know what a quarter a week can buy? Think about it. There's 1 quarter a week you'll thank yourself for spending. Because that quarter will buy Medicare, President Kennedy's plan for health care for our older citizens through Social Security. Do you know what Medicare can mean? For senior citizens 65 and over, it can mean up to 90 days, 3 months of hospitalization. You only have to pay $10 for each of the first 9 days. You pay the doctor you choose. But after that, Medicare takes over for those long illnesses that so often strike older people, where the hospital bills go up, and the savings of a lifetime quickly disappear. In so many of the illnesses of the elderly, long periods of a nursing home are necessary after the hospital. Medicare provides for that too, up to 180 days, 6 months a year, in a skilled nursing home. And Medicare would provide 240 visits by a visiting nurse in your home. Medicare would also include diagnostic service, examinations, complete payment over and above the first $20, no matter how many, no matter how expensive the tests. Medicare, like Blue Cross, is simply a means of paying the bills for the services covered. Medicare is insurance, paid up, non-cancelable health insurance when you retire after 65 for all the rest of your life, whether you have Social Security or not. You pay during your working years, and after retirement at 65, no more payments ever. A quarter a week can buy all this, so the things people plan and work for aren't wiped out by medical bills.
A couple of years ago, we were all set, Ellen and me. The little house in the country was all paid up, and we'd retired on our Social Security and a small annuity. The kids came down sometimes, but not enough to suit us. Of course, it's a long trip, but we thought they'd get down here more than they did. Still, we enjoyed it. Ellen kept herself busy around the house. I had my hobbies. Nice weather, nice fishing with old Bill. Though, come to think of it, I'm pretty near as old as he is. Those days are gone now. Ellen's illness and the hospital bills did it. So much time there with all the complications. Over a year. And everything we'd saved went for her in bills. The house, too. So here we are. I'd give anything to be back there, feeling we were standing on our own feet.
Medicare could prevent situations like these. Situations where big hospital bills wipe out the things people have saved a lifetime for. When this happens, it hits retired people hard when there's nothing they can do about it anymore. But it also hits the rest of us, too.
My boy Jim hasn't got much money. 4 kids don't leave much over. But I've paid my own way, and Jim and Betty like having me around. And it's handy to have someone else for the kids to pester when they get tired of it. The yard looks good. That was a lot of work. But maybe Gramps is running out of gas. I knew it was bad before the doc told me. He said it'll mean an operation and at least a month in the hospital. Maybe more. I haven't got that kind of money. Neither is Jim. So I've got to go down there and beg for charity. I never asked for a nickel of welfare in 71 years. I've got to go and look at all of them and answer their questions and tell them I'm a charity case. Worse, I've got to drag Jim and Betty into it, too, and prove they can't pay either. That's what kills me. Yeah, it's a nice afternoon. I'd rather die this afternoon than go begging. But what choice do I have?
When the big bills hit the retired, they hit the whole family. And often, they take their toll from those who deserve it least, the kids.
Just beginning to get our heads above water, do a few things for the kids, and bang, Mom's in the hospital. I just don't know how we're going to make the payments. Jimmy'll have to drop out of school. It's not fair, but I can't neglect Mother after all she's done for us. Sometimes there's just no way out.
No way out but one, Medicare through Social Security, so that people are not caught in a medical situation they just can't handle. A quarter a week is all it would cost, and then we could all do something about it. Right now, someone is trying to do something about it, trying to get Congress to pass the Medicare bill so these things won't happen in this country. He lives at 1600 Pennsylvania Avenue in Washington, D.C. He is the President of the United States.
I do not know why it's necessary for any of us who believe in this program to have to come and make speeches about it, because I do not know any problem or any remedy more obvious which now faces the Congress of the United States. The average older couple has about $50 a week to live on. The average older person living alone has about $20 a week. There is no room in that budget for a serious illness. Yet 1 in 6 will require hospitalization every year. The hospitalization will average 2 weeks, and the cost over $900. A $20 a week income, $1,040 a year, is hardly enough to pay for a $900 illness. Now, the person who has no resources, he gets a kind of treatment. He indicates that he's needy, and he gets some sort of help. But there's another person who I think is one that concerns us a good deal, and that's the person who may have $3,000 or $4,000 saved up, or who may own their own house with a mortgage, and may have 2 children who may be in their 40s. That person gets sick, the husband or the wife. They're in the hospital for more than 2 weeks, maybe 2 or 3 months, and there isn't anyone in this room who has not had a member of his family in the hospital at one stage or another of his life for a long time and know how much it can cost. So it may run up to $1,000 or $2,000, or even higher. And then he sells the home, or he goes to his children, he exhausts his savings, he has nothing left. Now, the program we suggested will provide that he will set aside during his working years an average of $13 a year. Not a burden for anyone employed, $13 a year. And that man and woman will know when they're over 65 that they will never be a burden upon their children and never be a charity case upon the national government, because they will have earned their way. And that's what we want. That's what we want. We're not asking for anybody to hand this out. We're asking for a chance to have the people who will receive the benefit to earn their way. The same principle established under the Social Security system in the 30s. You would not believe it necessary 30 years later, after we've seen the extraordinary success of the Social Security system, even though it was passed over the most vigorous objections, you would not think it necessary to say that hospital insurance shall be covered in the same manner. There isn't a country in Western Europe that didn't do what we're now doing 50 years ago or 40 years ago. Not a single country that is not way ahead of this rich, productive, progressive country of ours. We're not suggesting something radical or new or violent. We're not suggesting that the government come between the doctor and his patient. We're suggesting what every other major, developed, intelligent country did for its people a generation ago. And I think it's time the United States caught up. I don't think we ought to be second any place. $25 cents a week. I think this bill will pass. We were defeated 4 votes 3 years ago. We lost it by 2 votes in the Senate more than a year ago. My prediction certain is that if the members of the Congress, House and Senate, have an opportunity to vote on this, that this bill will pass in the 88th Congress. And when it does, every man and woman in this room will know that it was not a victory merely by the members of the Congress or the executive branch, but this was one piece of legislation that was carried on the backs of the eldest citizens of this country.
President Kennedy addressed the convention of the National Council of Senior Citizens, an organization of nearly 2 million members of older people's clubs located in more than 1,500 different communities across the nation. Nearly 2,000 delegates from more than 40 states also participated in one of the most dramatic demonstrations which has ever occurred on the steps of the Capitol building. They traveled in a long line of motor coaches along famous Pennsylvania Avenue, and they carried with them 5,000 multicolored helium-filled balloons. The balloons, which carried a Medicare message, were released when the delegates reached the Capitol steps, and they soared high over the dome into the skies above the District of Columbia. On the steps of the House of Representatives, the delegates were joined by leading congressmen who support the president's program. John W. McCormick of Massachusetts, the distinguished Speaker of the House, is one of the first to pledge his full support for speedy enactment of the program. House Majority Leader Carl Albert, often called the Pocket Dynamo from Oklahoma, said the program would help the elderly get the health care they need, lighten the burden of their sons and daughters, and protect savings for the education of grandchildren. There was Congressman Sam Stratton of New York, Torbert McDonald of Massachusetts, Don Fraser of Minnesota, and John Dingell of Michigan, among the many lawmakers who pledged their support for the president's program to provide hospital insurance for older people through the time-tested Social Security and railroad retirement systems. And when the speeches were over, the senior citizens dispersed to all areas of the Capitol, visiting congressional delegations from their home states and visiting the individual offices of their own congressmen. Public opinion polls show that most Americans favor hospital insurance for the aged under the Social Security system. Write to your congressman today, urging his support for the hospital insurance bill. Let us help all Americans to make provisions through Social Security contributions for their health care in retirement.